All right, go ahead.
Because her wounds tend, even with the use of hydrating products, gels and such, her wounds still tend to be very dry, and as such, the dressings tend to adhere to them. So we're using, this is actually a little nylon cover dressing that you put on the wound bed to help prevent them from sticking.
Like a telfa?
Unlike a telfa that you can drain through it, as you
I see, drains through.
And the problem
exactly.
with telfas is that they keep the drainage, they're non-adherent, I mean they're non-absorptive. So you have that drainage that tends then to start macerating all the surrounding skin. So this use of this product, even though it sticks a little bit, and I would probably use a little bit of water to help loosen it up, because you can see it'll just cause some more trauma if you just yank it off, which you don't want to do. She's been suffering with her wound for quite a while, and it's finally really starting to show signs of progression and healing. Previous picture, I showed her what your wound looked like initially and how much progress you've made. Compression, of course, is one of the keys to healing whenever you're having problems, any vascular type problems, because the edema, simply by the swelling, deteriorates the healing process. As you can see, she's been very good at keeping her compression. Instead of using a compression wrap, she has done much better with an ACE bandage. I'm personally not a fan of ACE bandages for only one reason, is that if you don't wrap them correctly, you can have areas, if they're not exactly 50-50, you're going to have more pressure, more layers in some areas, and then they tend to slip, and you may have, again, either the heel bulging or the toes or the double tourniquet. But she's been really good. Her bandages stay in place, or if they become loose or something, they do an excellent job of putting back, thus the good results, and you can see on the swelling. Nice looking wounds. Again, they're now in the proliferative as well as the remodeling phase. Remodeling meaning that she has the epithelial tissues that have formed, and so as the remodeling is simply the tensile strength is increasing, and this is a process that can last up to 5 years or longer. And again, your tensile strength never is exactly as you originally. At best, and this is probably if you were a teenager, you'd get 80% back. As you get older and with repeated trauma, it's a little bit less each time. So obviously she's probably going to be less than 50% the original strength, and because of the multiple areas of trauma. Risk factors, along with the swelling and her age and the chronicity of the wounds that we talked about. But in addition, even though they're very healthy looking wounds, she has a lot of wounds. The more wounds there, the more the body has to take care of it, where you have oxygen and nutrients to take care of one wound. Maybe two is just one too many, and it can't heal. Multiple wounds increases the bacterial burden, increases the risk for infection. So it's a big process. Again, a risk factor being lower extremity. Again, your circulation is impaired, but again, she's got good pulses. Her foot is a little cool, but her leg is nice and warm, and like I say, she's demonstrating good healing. One thing I would like to mention, and this is an example, I'm only saying it on her because we don't have one here. If you saw a wound that originally was that size, and it had the healing that came across, that's called an epithelial bridge, or a bridge of epithelial tissue. And it still should be documented as one wound, even though there's two open areas. Too many times they'll add that as a new wound, and it looks like you've created a new wound reading your documentation. So the appropriate way to document would be a bridge of epithelial tissue resulting in two open areas. You can say one top, bottom, superior, posterior, however you want to document it, just so it's clear that you have still this one wound, but you have this nice area of healing that has occurred instead of looking like you've created a new wound. So again, we're doing electrical stim. You put the moist gauze, because that's our conductor.
Well, she has a blister on her other leg.
She's had those kind of off and on for quite a while. And I don't think they've ever quite determined what's the cause of that one.
Okay.
Because she moves around a little bit, I just strap this on her. Gives her a little freedom of movement. She has a sensitivity to electricity, so the intensity is less than I normally use on the patient. She's the proliferative phase, so with her we are alternating positive and negative polarity every 3 days. And the frequency, if you notice, was 120, and then her intensity, 70 is the max that she tolerates currently. Which is better because we started off much less than 70, and so as she's healing, her tolerance for treatment is also improving, as well as the pain. Any pain today on your legs?
No?
Just painful hearing about them. As a joke, you're supposed to laugh appropriately. So you have to have filming in the back going, ha 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 ha.
What do you do at home to take care of your wounds?
These are the three I'm looking for.
My friend over there.
Your friend over here?
She's got a doctor at home.
She has a doctor at home to take care of you? Very nice.
He does a wonderful job.
Very nice. Very nice.
I have a doctor
The first
at home
bandage is
and a
about
doctor
the
in
hand.
London and a doctor in Minneapolis.
My goodness. You have a
The
house
second
full
bandage
then.
will be around
Very nice.
about the
All right.
forearm
Thank you
and
so much for
around
letting
the
us film.
arm on the back.
Okie doke, you're all cooking?